Hello, Nick Pierce, Microbiology 202. This is my video presentation for the Microbiology in the World Around Me assignment on August the 2nd. So my article is an article that I found in the New Scientist magazine. It deals with Ebola virus and the difficult symptoms that have arisen that scientists have termed post-Ebola syndrome. We all remember the outbreak that occurred in 2014. It only just recently wrapped up. The World Health Organization only recently declared Guinea, Liberia, and Sierra Leone to be Ebola-free. It's the first significant outbreak of the Ebola virus that had any meaningful survivors. It's also the first time that they tried any treatments. The couple experimental drugs were tried. They've even been trialing a vaccine in recent months that is aimed at preventing future outbreaks. The article that I am particularly talking about is an article by a lady named Deborah McKenzie. She wrote in May 2016 in the New Scientist magazine that scientists have recently discovered that after a person recovers from the Ebola virus, the virus can actually become dormant and migrate to certain types of tissues and organs in the human body and lay there and wait, no longer causing infection. The body will have defeated the infection, but the virus will actually remain dormant, ready to be released into the environment. It turns out that the tissues in which this occurs are primarily the retina in the eye and the seminal canal, as well as the testicles of the male reproductive system. This is particularly interesting because it turns out that these tissues are both tissues that don't have a lot of immune system defense mechanisms, probably in the testes because they don't want the immune system attacking, material that could be passed on genetically. Interestingly enough, the article talks about how this knowledge has shown that Ebola can resurface in an outbreak through the reservoir of a person who had already recovered from the illness. She talks specifically about an outbreak in Liberia, one of the smaller outbreaks of the larger outbreak in Liberia in 2015, where a survivor who had recovered had the virus come back out and cause another small outbreak that was luckily contained, scientists think, because there was also a vaccine trial going on in that same area. I think that this is a particularly important point, especially given how critical and how really just terrifying the Ebola story was and when it burst onto the world scene. Outbreaks like these are not going away. They're going to come back. It's going to happen again. And I think people have really woken up to the fact that these sort of emerging diseases need to be taken seriously, and that unfortunately one of the only real ways to find a lot of this information about how to deal with it, how to prevent it, comes from the experiences that we have in the outbreaks themselves. Personally, having worked through the Ebola outbreak here in the United States as a paramedic, when every hospital was just waiting for the next patient to walk in through their doors. When was this going to be the next one? Everybody that came in from Africa was screened heavily. One never knew. I remember the fear and I remember the uncertainty that went along with that. And so I think that every discovery and every attempt that we make to find more about these diseases will help the public deal with them in the future. This is Michaela Coburn. She's graciously agreed to listen to my presentation, and I think she has a few questions for us.
So how did they discover that the tissues, that the virus is dormant in certain tissues?
So the question was, if you couldn't hear that, is how did they discover that the virus is dormant in certain tissues? Well, it turns out that people who survive Ebola, according to the article and according to another article I read about post-Ebola syndrome, it turns out that survivors tend to experience significant joint pain as well as blurred vision and swelling of the eyes. And so scientists then realized that the virus was still probably affecting the tissues surrounding the eye, and they then discovered that the virus was still living in those tissues. In terms of the testicles and the male reproductive system, found out that the epidemiologists from the World Health Organization had actually found patients who had been infected via sexual transmission. So that's how they found that method.
And what do you think this discovery means? I know you touched upon it a little bit, but what do you think are some of the implications and risks to future outbreaks? Will we ever be able to get rid of Ebola?
So the question was, what is the implication for the future? And also, will we ever really be able to get rid of Ebola? Two good questions. I'll take the first one. The first is, what's the implication for the future? I think the implication for the future is that with diseases like this, the truth is we don't know. We don't know what's going to happen when we have survivors. We're now finding out information that we didn't even know before this outbreak, even though we knew about Ebola. It will help us provide post-outbreak preventive strategies, helping to distribute condoms, helping to eliminate the sexual transmission method as a possible vector for the disease. We now know that. In terms of the virus laying dormant in the eye, we now know that patients who are recovering from Ebola need to be cognizant of that if they're going to have eye surgery. If they come into contact, if they have an injury that occurs to their eye, can this be transmitted then to a healthcare provider who cares for that patient? I think it broadens the knowledge for what to do after somebody exits the death throw stage of the disease. In terms of whether or not we're going to completely eradicate Ebola, we've done it before. We did it with poliovirus. Although I think any good public health professional will tell you that we probably aren't going to do that unless we have a really effective education and prevention strategy, as well as probably an effective vaccine. Okay, so it turns out that my reviewer doesn't have any more questions. So I hope I have provided an interesting take on what is a really dangerous disease, one that I have a better understanding of now through microbiology. I now understand that Ebola, like other RNA viruses like HIV, why they're so notoriously difficult to treat, why it's been so hard for drug companies to come up with effective treatments, and why it's been so difficult to come up with a vaccine up until now. I hope that in the future, that if and when another outbreak happens, we're going to learn from this, and that the knowledge that we have gained here in my course of microbiology will help me to better understand the ins and outs. I hope you enjoyed the video. Any comments, please feel free to leave them, and I look forward to finishing up the rest of the course. Thank you.